silver cream, especially if you're dealing with any sort of wound or abrasion. So we take just a little bit of silver cream, and I'm not going to go through all those motions just because it's a demo. We're going to take a little bit of silver cream on our hands. You can use Furazone, but if there's an abrasion, we don't like to use that. And take a little bit of DMSO, about 3 lengths of a toothbrush. 3 lengths of a toothbrush. Boom, boom, boom. And then this, and then we're going to wrap. I'm going to go to our front leg, and then you rub over the affected area and rub that in. So I got that all in. It's all full of DMSO. Notice I'm using a glove on purpose.
You said you don't use DMO if there's an abrasion?
No, I don't like to use Furazone if there's an abrasion. I'd rather use the silver cream if there's an abrasion. Have your supplies ready. So we have leg cotton, we have plastic, and we have vet wrap. Since DMSO is going to make your mouth taste funny for some time, I use the glove.
Do you agree with the garlic taste?
Yeah, I agree with the garlic taste. Yeah. So this would be nice and sticky because we put the DMSO and the either the Furazone or the silver cream. I'm going to wrap that around like that. Put the cotton on. Grab your vet wrap. We have pink for my girl today.
You're pink.
Start in the middle. Try to keep it as smooth as you can. Work your way up. Even pressure is the technique. Extra, just come on back up. You can use track wraps if you'd like also. And then I like to, when you come to the end, just kind of push that around like that. It adheres to itself quite nicely. You can apply elasticon to the top if you need to. You can apply elasticon to the bottom if you need to. You get your fingers underneath the Band-Aid, underneath the vet wrap, and that's all there is to it. Don't go more than 24 hours ever on a sweat wrap. You can burn them with the DMSO. You can
what
cause
are the
burning.
reasons why we would be doing this again?
So,
Swelling?
well, DMSO is a fantastic anti-inflammatory.
Okay.
It takes out the swelling, so it's going to allow, it's a solvent almost, and it allows the swelling to drop down. Once we have the swelling down, then you can often see what's really going on with the leg. So we have an injury of some sort. We have a tremendously swollen leg. We don't know what's going on. We DMSO it, and then you can see what's going on. There's also other uses your veterinarian will use in some case to do what's called secondary closure, where we can't close it with a suture the first day. We'll DMSO because the tissue's swollen. We'll use DMSO to take out the swelling, and then we're able to close the tissue.
Now, would we ever do this without even calling you guys, though?
Sweat wraps are something you can do if you see a swollen leg yourself.
So, so does it put a potential injury?
If you have
if we haven't called you, though?
If you have a wound, we're talking about a wound, an abrasion or something to that effect, then if it's a full thickness wound in a danger area, you want to call your veterinarian, just as we discussed. If there's an abrasion, you can manage the abrasion. If there's an abrasion with swelling, you can manage that yourself. Okay. If you just have some swollen leg, it's like you went out riding, bonked himself, did something, you can use a DMSO sweat wrap yourself. And then obviously if he doesn't respond, and then you need to call your veterinarian.
Right. Okay.
But we were talking about wound management,
Yeah, exactly.
and the important part there is the difference between an abrasion and a full thickness, and a danger zone and a non-danger zone. If you keep those in mind.